and everyone is in different fields. So I'm sure that you're going to have a very good mix of people from across different industries, such as metal 3D printing. Then there is specific point of care labs. Then there is bioprinting, there is dentistry, etc. And this is one of the reasons why I joined 3D Heals as well, was to be able to network, was to be able to shine some light on this technology and showcase what it can do, and also find some solutions, for charting a path for the future. So let's begin with the presentations. I'd just like to reiterate again, in the interest of time. The questions will be taken mostly, maybe one or two questions after the presentation, but mostly after all the presentations are done. So the first speaker that we have is Dr. Mahesh Kapanel. He is a professor of pediatric cardiology at Amrita Institute of Medical Sciences and Research Center, which is in Kochi, Kerala. And he's also the founder and lead of the 3D printing, virtual reality and innovation laboratory at this Amrita Institute, which is actually the region's first point of care lab set up by the hospital. Dr. Mahesh, I'll pass it on to you. And yes, let's hear more about your experience and journey over here.
Thank you so much, Firoza, Jenny, for the introductions. And I'm very excited to be here to share my experience, especially from the perspective of what we call as a resource limited environment, right? So we're looking at how technology can be useful even in an environment such as ours. So I'm assuming that I'm visible and audible. Please confirm that for me.
Yes, you are.
Okay. So to introduce myself, as Firoza said, I'm a pediatric cardiologist. I'm a professor of pediatric cardiology at this particular hospital, which is called the Amrita Institute of Medical Sciences and Research Center. This is based in Kerala, which is in the southernmost part of India, for those who are not familiar with the Indian geography. I'm a pediatric cardiologist, so I take care of children with congenital heart disease. And as the cardiologist, I see a very bizarre range of complexity of congenital heart disease. And it's incredibly difficult to comprehend anatomy, and comprehension of anatomy is crucial to actually being able to heal our patients or treat our patients effectively. So the problem statement eventually revolves around the fact that imaging, this is the way that I as a cardiologist look at cardiac images. So it's in the form of either echocardiograms or angiograms or CT scans or MRIs. So this is the way we look at the heart, and mostly it's all two-dimensional visualizations. This is despite the fact that much of medical imaging is actually 3D volumetric. If you look at the CT scans or MRI or even 3D ultrasound, you're actually acquiring three-dimensional volumetric imaging data sets. But most of the time, we're visualizing them in pure 2D. We're looking at slices of information, holding up a film or looking at a workstation. And this is an essential problem that we face. And in 2009-10, I helped establish the country's first congenital heart MRI program in our country. It still remains the only dedicated congenital heart MRI program, but still we are challenged by the fact that we only visualize in 2D. While human biology and pathology actually occurs in 3 dimensions, we're operating in 3-dimensional spaces. And so that's where the challenge was. When I set up my MRI lab, I was delving deep into cardiac images, understanding what goes into the complexity of heart disease. But it was incredibly challenging to actually, firstly, to understand what these images actually mean in the 3-dimensional spatial environment. Second, in communicating this complexity to my colleagues, my fellow surgeons, who are eventually going to be operating, or myself when I take the patient into the interventional lab. So planning treatment is significantly challenged by the fact that we look at 3-dimensional medical images in 2 dimensions and try to figure the rest out in our mind. So way back in 2009 or 10, I was actually building heart models by hand with modeling clay or plasticine, because I would spend hours trying to understand anatomy. I'd try to replicate that with handmade models and take that to our meeting to show it to my colleagues as to this is what the anatomy is looking like. This is roundabout also the time when 3D printing was really expanding. And it's in 2004 that the whole open source revolution began to happen in the space of 3D printing. And around 2009, as Kickstarter came on and startups like MakerBot and Formlabs began to leverage the fact that the key patents on FDM and SLA text were expiring. And that's when they began to make these desktop models. And by 2013, 3D printing was becoming mainstream. And this was also the time when I was looking at solutions to kind of solve my own problems of looking at medical images. But at that time, India was still lagging behind in mainstreaming 3D printing. Healthcare in general was quite slow to adapt and adopt, except for maybe a few pioneering centers like the Mayo Clinic at Rochester and SickKids Toronto, which had been early adopters of the technology in healthcare. I was still making handmade models, but I was watching this space of 3D printing pretty carefully, particularly whether we in the resource limited environment can actually leverage that. This particular crucial time point was when I came across this young patient, Hari. I think Firoza is very familiar with this particular boy. He's been a true inspiration. When he came to us in 2013-14 with a really, really complex heart disease, who'd been rejected heart surgery at most of the major centers in our country. He was 17 years old and he'd been told that there is no real medical solution for him. And when we did the MRI, I could figure that yes, it was fixable, but again, I was challenged by the fact that I could not convince my colleagues about his operability in terms of his anatomy. And this was the first time in 2014 when I began to collaborate with Materialize and Belgium, who were really foraying into the space of 3D printing, including in healthcare. And this was the first 3D print of a heart that I ever did way back in 2015. Incidentally, Dr. Mohan Reddy, who's one of the most reputed cardiac surgeons in the world from Stanford, he was visiting our center at that time. And when I presented the 3D model to him and the rest of my team, they were quite stunned at how much the 3D model was actually able to tell us about the patient's complex anatomy. In fact, even for Dr. Reddy coming from Stanford, this is the first time that he was actually handling or seeing a 3D model of a heart. And this patient could successfully be operated thanks to this technology where we were able to understand the anatomy well. And the story doesn't, however, end there, because this young boy turned out to be an amazing kid. He was a brilliant tech wizard who, while he was ill with heart disease, was reading about technology. He had assembled his own 3D printer just a few months before he was operated. And I'm talking about 2014-15, when few people in India actually knew about the technology. This kid is now a healthy, young, smart young man, 23 years old. He's an entrepreneur. He's founded his own 3D printing startup. And that's a picture of him at the Mayo Clinic and even at the Stratasys headquarters in Minneapolis. So this was a real story that became a turning point for me, because this was proof of concept that 3D printing can be a very powerful transformative tool which can save and affect lives in a very deep manner. And this became the trigger for me to set up our country's first point of care medical 3D printing lab at my hospital. It didn't happen overnight. It took baby steps because the technology was new, the whole environment was new. And we began to delve into it in a very, very step-by-step manner. First, we began with finding more and more use cases for using this technology, initially just with pediatric cardiology, later expanding to other specialties. We began an active engagement with major partners like Materialize Envy, and also sought collaborations with dynamic young startups and innovators in the space, like Firoza, anatomist. She had just about founded Anatomist 3D at the same time, and both of us were actually working parallel at that time. And this was coincidence, and this was fortuitous. And Firoza became one of my early partners, where we could talk about this. There were very few people with whom we could actually discuss this. And Firoza became a very active partner in my foray into 3D printing. And as we went along, the use cases began to grow exponentially. This was another young boy who was 13-year-old, denied heart surgery multiple times because of heart complexity. And having a 3D print made all the difference, because it enabled us to operate this child with a really complex form of congenital heart disease. So he was a second boy, in my experience, for whom we used 3D printing. And we quickly published these things in the media so that, there's some leverage, so that, people come to know that there is this technology and this is how it can help. I think that's very important that we speak about it, we evangelize the technology, because this is stuff that most people don't really know about. And soon after that, we had this third case in which Firoza actually printed out this heart model for me. This was a young infant with what we call as a crisscross heart. And yet again, it was only because we had 3D printing to assist us that we could actually operate this particular case yet again. So this again proved the value that we could realize the value, but for us to grow this ecosystem, we needed to convince others too. And what helped was that we applied for certain awards. We came into the mainstream, and this helped us win a couple of really prestigious awards in innovation, which included a national award for innovation in healthcare and even an invitation to the President House in India, which really gave us a lot of leverage, which we could use with our own hospital administration to lend us support in building this ecosystem further. And we also began to scientifically publish our experience so that we had a scientific validation for what we were doing. And this is what set the stage for the development of a robust point of care facility within our hospital. As we know, the workflow starts from imaging. Then this is the most crucial step where we have to segment out the DICOM files and convert it into a virtual 3D file. I think this is the most crucial step. And this is where we convinced our institution to help us get some software. And we invested in the materialized software as our first step in actually starting a POC lab. At that point of time, we did not have 3D printers of our own, but we just invested in the software. We started working on our patients, and in selected cases, we would create the virtual 3D files and then export it out to Firoza and other third-party 3D printing services, which helped provide the models to us. Subsequently, we invested into 3D printers for our own lab, and we started not very big with very high-end printers, but with very simple SLA and FDM desktop printers, which helped us get from DICOM images to 3D files quite quickly, all within our own ecosystem, all within our own hospital, and within a matter of hours of having the patient actually come to us. So this really began to tell us how impactful and deeply powerful this technology was, because we had such a deep immersive experience now interacting with medical images, especially as compared to our conventional way of interacting with medical images. And over a period of time, our entire repository of complex cases and complexities and morphologies began to grow exponentially, and we began to do more and more cardiac procedures assisted by 3D prints. And not only doing procedures, all these models also went into a teaching repository where our fellows in training and our surgical residents in training, they could all use these 3D models to understand anatomy and look at them in a much more deeper way and be better doctors, be better physicians and surgeons. I think that's where the technology was really helping us do that. And not just surgical procedures, we were doing complex interventional procedures using bespoke solutions. We also realized that in all of this, while technology is on one side, we also need the human skill as a critical component. And we began to build an ecosystem of people with shared passion, other specialists from other disciplines who were interested in leveraging this technology. For example, the craniomaxillofacial surgeons, they just took it to like fish to water. So that really helped us build our ecosystem, because if I was to run a 3D lab in my hospital purely on the basis of heart models, it would not be very sustainable. But when I have other specialities involved in it, and we are regularly printing out 3D prints, it adds to revenue. We had built a very optimal kind of a revenue model so that we kept generating some revenue, which would win us more support from the institution and make the whole project much more viable. And as the scope expanded, we became a multidisciplinary ecosystem with a lot of innovative thinking, innovative applications. We've done a lot of first in the country, first in the world surgeries and interventions based on 3D printing technology. When we started, it was only about anatomical 3D models for planning. Then we went on into deep virtual surgical planning, as in case of craniomaxillofacial surgeries, printing out surgical guides and implant design, all within our own environment. And this kind of a multidisciplinary environment really helped us gain a foothold in our own institution and also outside of it. Just giving a couple of rare examples, this is an infant with a disease called the absent sternum, where the breastbone is absent, and he could otherwise not have been treated effectively, but for the fact that we were able to actually visualize the anatomy, went ahead to 3D print out the patient's rib cage and planned this whole surgery where we reconstructed the sternum using a piece of the patient's own seventh rib. This whole surgery being actually planned and executed and discussed based upon these 3D printed models, and we were able to execute this very complex surgery very effectively, saving the life of this patient. Here's another patient who was brought to us by the National Geographic, a patient with a huge tumor over his face, where again, he had been, left without any treatment, and he was brought to our center, and we were able to use 3D printing to plan this very, very complex and morbid surgery and remove a 5-kilo football-sized tumor from this patient's face, and also reconstruct his entire face and his skull using 3D printing technology. This whole thing was actually televised and shown on a series of Body Bizarre on an episode on TV. This is my own aunt who had a metastatic tumor on her pelvic bone from a thyroid carcinoma. And because of the deep-seated position, she'd been refused surgery. But when I combined her MRI and CT images and 3D printed out the anatomy, it became possible for us to treat her. Until that point, we had been a purely clinician-driven team, but subsequently we realized, no, that's not a practical thing. It's not a feasible thing. We needed to have strong core engineering competence. And Sarin became our first engineering colleague to join us in our hospital environment. So he's an engineer, but working with in our clinician-driven team in the hospital. And this, again, propelled the next stage of innovations where it became much more easier for us to design cutting guides, implants, etc. It became much better, more accurate, and saved a lot of physician time as well. So this was a sternal implant where we took the help of Jujal Medical, one of the companies in India, to actually design this implant, but we didn't have the money. The patient didn't have the money for a titanium implant. So we built a mold from the 3D print, used PMMA, and put the implant in. So these are ways in which we, in the resource limited environment, sometimes have to adapt. But today, this is an implant we designed just today for a patient who's going to have a sternal resection for a chondrosarcoma of the chest. So now we are able to do all of that in-house. And then for the metal printing, we would export it out to people who have the expertise and the wherewithal to print this out and give it to us. During the COVID times, we did a lot of innovations within our own lab, from masks to various kind of personal protective equipment, including PAPRs. And we are inventing and making little bits and pieces and parts for things that are broken down in the hospital. So that again is a wonderful way in which a POC lab is able to actually help the ecosystem within a hospital. A little ventilator adapter broken would mean an equipment worth several hundreds of thousands of rupees flying waste, whereas we could go from design to a prototype to a deployable object within a few hours within the hospital environment. So this again was great. We won several awards during this process, which more than the winning of awards, it's about being able to speak about technology, evangelizing it, making more people aware of what's possible. I think that's a very valuable thing, and we all need to do it, be it being out there on the media or scientific publications. All of this is important. The next major evolution in our journey was realizing that it's not just 3D prototyping, but also extended reality, which is, again, a very important part of what we were doing. Because every single virtual 3D file that we were creating, we could actually have a perpetual virtual model, which we could bring into AR and VR as invaluable learning, teaching resources, which will last forever. A 3D print may break down. It has a shelf life. Whereas the virtual file, which we have created over these years, each of that has now gone into a curated morphology library. And this young man who you see with me in the 3D lab is the same young boy, Hari, who I talked about, the first patient. He is an integral part of my 3D lab today. He is deep into technology, and he's helping me and Sarin and my team develop newer applications for these technologies. So it's very exciting that now we not only have 3D printed prototypes, but also virtual models, which we are able to use effectively in various ways in planning complex surgery, walking into say the heart, looking inside, and across specialties. This again is making a very, very deep impact. And this is me and my surgeon discussing a complex case before going in for surgery. Just last week, we had a patient from Africa who had been refused surgery at the major hospitals in our country with an extremely complex and rare disorder, and where we were able to operate only because we were actually able to walk in and out of the heart. And a virtual model actually allows you to dissect it in infinite planes infinite number of times. So I think it's a very effective and powerful tool that we must use more and more. Many times we use it in combination. It's not just one or the other, but a combination of virtual and 3D printed prototypes, again, can be extremely helpful as in these cases. Companies like Elucys like Realize Medical, who have Elucys, build wonderful tools for, even segmentation can occur in virtual reality, and also allows for collaboration in the virtual reality space, where you can be in different geographical locations, but still be able to discuss the same case together as avatars. And this is us playing with the Microsoft Hololens. Just a couple of weeks back, we are planning to acquire the Hololens also for our next stage of development of AR and VR applications in healthcare and medicine. So we've gone through this whole range of applications where we're using 3D plus technologies, and including a bioprinting facility, which is there at our hospital. So we are looking at spanning this entire spectrum from imaging to various applications of 3D plus technology. So it's been an incredible journey so far, but we have a lot more to do. And I feel that technology is a great leveler, and there is tremendous potential for these technologies, even in resource limited environments such as India. And the critical thing is that we need to collaborate and co-create all along the way. And this whole journey has been about innovation and collaboration. Thank you so much.
Perfect. Thank you. Thank you so much, Dr. Mahesh. For everyone else who has any questions, please do feel free to drop it in the box. Dr. Mahesh, I have some question for you while they do that. So, I mean, I've seen you go through this journey in the initial phases when you were procuring and everything, setting up the lab. If you could elaborate on the challenges that you faced in creating that awareness, introducing the technology, and from what I see, having scaled up so much into so many different avenues and so many different added advanced tech. If you could highlight those challenges that you faced and how you overcame that.
Because I think we continue to face those challenges. One of the major challenges is to persuade medical professionals to adopt a new way of doing things. Because somehow in the medical profession, we tend to live in silos where each one of us in our areas of expertise thinks that we know best. I think that's a huge mental challenge. I think I face that as the biggest challenge, even within my own hospital, in order to convince people to just try the technology, to see how it works in their area of work. That was really the biggest challenge, I would say. Second challenge was convincing the hospital administration to invest, because this technology, be it the software or the hardware, does cost some money. So getting the institution to invest into this was the second challenge, which I try to circumvent by proving the value for these technologies, by winning accolades for the institution, putting the institution in the limelight, putting our work in the limelight, be it in media or be it in scientific publications. So that helped us get a kind of a support from our institution, and we continue to do that. I still endeavor to make sure that the administration is aware of the cutting edge stuff that we're doing, the first in the country, first in the world cases. We make sure that the administration is made aware of that, so that as we upgrade and upscale our lab and our applications, we have a continued support. Third has been going out of the hospital and evangelizing it to the general medical fraternity. I think we need a lot more forums. I think 3D Heals is doing a great job of providing a forum where we can come on a platform and talk about it and be out there for others to listen and understand what's possible. Because many a times we think that, okay, there is some fancy technology, but it's all in the realm of for somebody else to do. It's not for us. We can't do it, or it's not possible in our environment. I'm proving that even here in India, in a resource limited setup, we can set something up like this, which has such deep, powerful impact on actual human life. That's eventually the manifestation of what this technology is about. And fourthly, I think the most important thing is that we need to all work together. The private players in this part, the industry, the companies, the hospitals, all of us need to work together. It's not either or. There will be space for POC labs. There will be space for pure service providers or expert designers and printers. I think it's the whole ecosystem that has to go.
Right, right. No, thank you so much. I think I mirror a lot of those thoughts as well. And we do have some questions over here, but I guess in the interest of time, we should move on to the next speaker. And after all the presentations, we can take the questions again, Dr. Mahesh.
Sure.
So,
Thank you.
yeah, thank you. Thank you so much for the informative presentation. Really, really appreciate it. Our next speaker is Dr. Jatin Kakrani. He is the co-founder of Smiles.ai, and he is a certified dental implant and digital dentistry trainer. He's also a DCI accredited speaker and a gold medalist prosthodontist. Dr. Jatin, I open the floor to you.
Thank you, Firoza. Thank you, Jenny, for having me. So I'll start with my introduction about my company. So we are the fastest growing consumer dental care brand in India. We started 3 years ago with two people team like me and my brother, who is co-founder as well, luckily. And right now we are 450 people, big team, and we are the second largest manufacturer of aligners, which is a device used to straighten the teeth, and which is being made with the help of 3D printers. And we are having the world class aligner manufacturing plant in Bangalore. We have the best 3D printers in the industry for making that, and we have the best investors on our cap table in dental industry. Like, we have Sequoia Capital, Falcon Edge, we have Charate Ventures, NBX Capital, and marquee angel investors like Piyush Bansal, Amit, who are co-founders of Lenskart. So we have been able to perform well because of various reasons, and one of them is leveraging technology. And in technology, 3D printing is one of the most important aspect which we have leveraged, and I'll share like how we have done that in a later part of this presentation. So we started the Smiles.ai with the vision of building India's and MENA, that is GCC region, Dubai, Abu Dhabi, and all Southeast Asian countries, largest and most trusted dental and derma brand. And we are on track to do that. I hope my screen is visible.
Yes, yes, it is.
Okay. So major problem with the dental care was dental care market is highly fragmented, and 99%